All drugs for ADD, ADHD symptoms work on the brain. Most are pills. Some are patches that stick on the skin and are absorbed into the body. Both types of medication work their way into the blood and then to the brain. This is a picture of a close-up image of one of your brain cells. There are billions of these in the brain, and each one reaches out to several others. They all talk to each other by sending chemical messages to each other. So this image is of one brain cell reaching out to others. So this image is of what one of the ends of those arms looks like. The cells don't actually touch each other, but they have long arms that come very close to each other and have a gap in between. The cells talk to each other by sending messages. The messages are actually chemicals. This is a picture of two cells really close up and the gap in between them. The messages are those small little tiny dots of light. So one side is passing the chemical messages to the other side. One cell sends the chemical messages. The messages float around between the gap, and the receiver side waits for the chemical messages to just float on over to it. The brain is not wasteful of even one of those chemical messages. If the chemical message doesn't drift over to the other cell and be received, then it goes and returns home to the sender. They uptake back to the sender so they can eventually be spit out later in time. So the goal of ADD and ADHD medications is to increase the chemical messages received. So that side that's the receiver end, we want more messages to make it over there. So there are two types of stimulant medications. The first type is to turn up the faucet a lot and to slow the reuptake just a little. The idea here is to have the sender create and pump out lots more chemical messages, so lots more of those little dots. They also slow the uptake just a little bit so that the chemical messages float around longer. These type of drugs are amphetamines. Examples of amphetamines are Dexedrine, Adderall, Disoxin, and Vyvanse. The second type of stimulant medication is to turn up the faucet just a little bit and slow the reuptake a lot. The idea here is that the longer that something floats around, the more likely it will reach the other cell. So increase the dots just a little bit, but let them float around a lot longer. These drugs are types of methylphenidate. Examples of methylphenidate are Ritalin, Metadate, Concerta, Quivalent, Daytrana, and Focalin. The third type are non-stimulants. They work on slowing the reuptake only. Examples are Strattera, Intervive, and Copve. If you have a family history of mood disorders or your child is not responding to stimulants, non-stimulants may be an option. So the next question is, why do we want to increase these messages? Well, studies show that stimulants increase brain activities in areas that are important for executive functioning. More message means more activity. More activity means we see less ADD and ADHD symptoms. Research also shows an increase in perceived reward. An increase in perceived reward and to be motivated by that reward to do actions. So this tackles the motivation issue of doing things that are not interesting. So stimulants increase the amount of norepinephrine and dopamine. These are the messages that were between the cells, those little white spots. What it causes is an increase in blood pressure and heart rate, constricts blood vessels, increases blood glucose, and increases breathing. It feels like the more alert, more energy, and more attention, and a sense of euphoria. There's also some side effects: restlessness, tremor, anxiety, nervousness, headaches, dizziness, insomnia, dry mouth, unpleasant taste in the mouth, diarrhea or constipation, impotence, changes in sex drive, nausea, vomiting, increased blood pressure, tics, drowsiness, and there's also a potential for cardiovascular failure or heart attacks or lethal seizures. Rarely hallucinations and hives as well. So remember, some side effects go away in 4 weeks or so. A lot of side effects aren't experienced by everybody. Some side effects are helped by the time of day and the dosage. Your doctor can help you with these things as well, and will be monitoring. Studies have shown that some children on these medications do not grow as tall as they might be expected to grow. It is speculated that this could be the result of the side effect of decreased appetite, that maybe the children aren't growing as tall because they didn't eat as much. So watch out for loss of appetite and make sure your child is eating as much as they did before. These drugs are considered to be safe, but it's difficult to have long-term studies that show what keeping your heart at higher blood pressure through childhood does, or what it does to the brain because of different environments, homes, diets, genetics, dosage, frequency taken, etc. It's difficult to say what the long-term effects are. Maybe there are no long-term effects. Studies do suggest, though, that taking a stimulant does not increase the risk of becoming addicted to stimulants or cocaine as an adult.